Care proceedings are family court proceedings concerning whether or not to place a child into care. Here I look at data from women who are involved in care proceedings in South London to look at how they use mental health and substance misuse services before and after care proceedings. Children whose mothers experience mental health problems or substance misuse are at increased risk for a number of poor outcomes over childhood, including statutory child protection intervention and being placed into care. However, in England, there's little quantitative evidence on the parental health-related risk factors for child protection to inform evidence-based strategies to respond to parental healthcare need and to potentially reduce the risks of involvement in care proceedings and entry into care. In this piece of work, we aim to describe the service use trajectories among women in the 2 years before and the 1 year after onset of care proceedings. We also aim to describe their mental health and substance misuse service characteristics. We use data on women involved in care proceedings in England, linked to de-identified electronic patient records from the South London and Maudsley NHS Mental Health Trust. 2,538 women were involved in care proceedings in the 4 South London boroughs where SLAM delivers services between April 2009 and March 2019. Of these, around 2/3 linked to a SLAM service user record at any point. SLAM also deliver the improving the access to psychological therapy services. We use latent class trajectory models to group women with similar trajectories of SLAM service use in the 2 years before and the year after onset of care proceedings concerning their child or children. We modelled the number of days per quarter that women had a SLAM service contact, which included outpatient attendances and inpatient bed days. Although we considered models with 1 to 7 groups, after assessing all models, we concluded that the model with 4 latent trajectories best fit our data. Over 10% of women in our study cohort were assigned to Group 1, which was characterised by high service use close to onset of care proceedings. A similar number of women were assigned to Group 2, which was characterised by sustained service use over time. Almost 3/4 of women in the study cohort were assigned to Group 3, characterised by low or no service use. In fact, around 1/3 of women in this group had no SLAM contacts in the 2 years before and the 1 year after onset of proceedings. Finally, just over 3% of women were assigned to Group 4, which was characterised by low service use before onset of proceedings, but high service use in the year afterwards. The median age at onset of care proceedings ranged from 30 to 34 years old among the study cohort. And most women had at least one psychiatric diagnosis recorded by SLAM. Prevalence of substance misuse was high, ranging from 25% to 51%. And in the 3 high service use groups, prevalence of having a psychotic disorder diagnosis or accessing psychosis services in the 2 years before and the 1 year after care proceedings was common. Many women in the high service use groups also accessed acute mental health care at SLAM. This included inpatient care and also accessing places of safety and other crisis support services. Among those that were admitted to SLAM inpatient care, the average length of stay was around 1 month. And in the 3 high service use groups, being sectioned under the Mental Health Act in the 2 years before and the 1 year after care proceeding onset was common. Among all the groups, many women had a child under 1 year old involved in care proceeding. And admission to the SLAM mother-baby unit was uncommon. Our findings found a high prevalence of mental health and substance misuse service need among women involved in care proceedings in South London, yet those who accessed services typically had low service use in the 2 years before and the 1 year after onset of care proceedings. There are also several limitations to this piece of work. Further work includes exploring women's service engagement and identifying risk and protective factors for returning to court for further proceedings involving a new child. Thank you for listening.